It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Welcome to Innovations in Health. I'm John DeShula. We're talking about the mini dental implant procedure, and I'm welcoming Dr. Brent Bradford from the Mini Dental Implant Centers of America. They're in Liverpool, New York. We're going to talk all about the mini dental implant procedure that's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. We're going to get to know Dr. Bradford in just a little bit. But for everybody here in central New York, from Syracuse to Liverpool, Auburn, and everywhere in between, your life can be changed. You can be you again with the mini dental implant. It's FDA approved. It's an in-office procedure. And you know what? All the food that we love here in central New York, our dinosaur barbecue, biting into a juicy steak, crunching into an apple and an ear of corn, all of that confidence can be yours again. If it sounds too good to be true, it isn't. It is the real deal. And Dr. Brent Bradford has been practicing with the mini dental implants for many years. Let's start, Doc, by taking a look at that mandible in front of you, because this will show us the difference between a conventional implant and a mini dental implant. Just take a look at the difference.
You can see the biggest difference is the diameter of the hole that's drilled in the jawbone when we're placing a conventional implant. It's significantly bigger than the small pilot hole that's drilled for the mini implant. It also requires a surgical procedure that involves an incision in the soft tissue, where the mini implant, again, is just a pilot hole drilled right into the tissue and into the bone, and the implant is inserted in. This reduces the healing time and the discomfort that might be felt.
It takes months and months sometimes for the conventional implant, and just the size of the hole alone makes it just so much better and a much more accommodating procedure. Now, if you have a denture and a lower denture that's used to swimming around on the bottom of the gums and that sense of discomfort and the confidence that doesn't exist, the mini dental implant, Dr. Bradford, will change that. Show us why with this stabilization technique.
Sure, John. As you can see on this lower jaw model, we place 4 mini implants into the lower jaw. It's a painless procedure done under local anesthesia. And then we place the housings inside the denture with the O-rings, and the denture then is snapped into place. And you will leave the office with a secure, tight denture.
And with the denture, and the lower denture particularly, I know that people who have them are used to using goop, the adhesive that gets all gunked up and you swallow it. It must taste terrible. The goop is gone, isn't it, Dr. Bradford?
The goop is gone, John. We can throw that tube out. Patients, it's the first comment they make when they come into our office wearing a denture is that, can you get rid of this goop? We're glad to do that.
Now, odds are if you have a lower denture, you probably have an upper denture. And now the palate is actually exposed.
The palate is removed from the denture, and you can see that opens that area up. So now you can taste your food again. You can also feel that sense of hot and cold with the food. And another nice thing is when we take that palate out, it helps a patient that might be a gagger to reduce that gag reflex. In the upper jaw, we'll place 6 mini implants. We then again put the housings inside the denture, and the denture snaps securely into place onto those mini implants.
And let's flip that up and take a look and see. So that upper is just beautiful. And you mentioned gagging. It also affects your speech pattern too sometimes with that plastic that's up there to keep that suction of the denture next to the gum.
Yes, it does. Your tongue wants to go up and feel that hard acrylic on your palate, and you can have some lisping sounds.
Now, I know with dentures, you'll work with the patient not only with the denture that they have, but sometimes you create a new denture for them, don't you, Dr. Bradford?
That's correct. A lot of times when a patient comes in with a denture that was designed without the mini implant as a retention mechanism, it's just not designed correctly to receive that housing inside there. So we may have to remake that denture so that it'll fit in place like it should.
Now, if you have a denture and you need the mini dental implant, we'll show you where you can connect with Dr. Bradford in just a little bit. But there's another level to the mini dental implant, and what we're going to show you now is what we call the fixed on 6. So some of the plastic, well, all the plastic is gone because it's not a denture, it's like a full set of teeth, isn't it, Doc?
It is, John. As you can see from this model, this is a beautiful restoration, and that plastic is gone. What we do in this case for the Fix on 6 is we place 6 to 8 mini implants into the jaw, and then the Fix on 6 is made from a zirconia material, and it's a very hard material. It's also a beautiful material because of that hardness. And what we do is we will snap that into place, and once we snap it into place, you don't take that out, it stays in place. This is what we call a retrievable appliance because it is retrievable by your doctor. So when you come in for your hygiene visits, I'll take that out. We'll check and make sure that your implants are secure, that the tissues are healthy, and then we'll snap it right back in and send you on your way.
So it's encouraged to the patient to come back to see you for their hygiene visits, the cleaning, and then to check to see that the mini is doing pretty good.
Oh, absolutely. I want to encourage patients that have implants. Just because you have an implant doesn't mean that your tissue doesn't need to be cleaned. So once a year at least, we like to see a patient back.
And that's a great look. Now, there's an even better gold standard for the mini dental implant. If God gave us our baby teeth and our adult teeth, Dr. Brent Bradford from the Mini Dental Implant Centers of America is going to give us our third set of teeth with what we call the roundhouse.
This is a roundhouse, John. This is the gold standard of mini dental implants. The roundhouse, we place additional implants, usually 10 to 12 implants, and then this appliance is cemented into place. So we cement that in, you leave the office, and no one takes that out.
And it's an upper or a lower, and if teeth need to come out, you'll work with the patient on that. But look how good that looks down.
This would be the lower version, and the upper version, you can see it's just a gorgeous roundhouse bridge in there.
It looks beautiful. Now, if you have teeth that are in the back of your mouth, the mini dental implant will help you. I know some of you are out there and you're saying, well, they're out of sight, out of mind. I've been dealing with it for a while. You should not do that. Those back teeth are very important. They're the worker bees, if you will, because the teeth chew the food, get the nutrients out, and if you have a problem with a bridge or a partial, the mini dental implant will help. Show us why, Dr. Bradford.
Yes, John, as you said, a lot of patients think if they're missing a back tooth, no one sees that area but their dentist. But it's important in the way that you function and you chew your food. And you need to be able to chew well to get the nutrients out of that food so you can be healthy. In this case, we can see this patient was missing 3 teeth, so 4 mini implants were placed and a 3-unit bridge was made. And that bridge is just cemented right on top of those implants and you're good to go.
Now you can give us a little science lesson about the tooth, because when the tooth comes out and the root is gone, what happens in the body and the chemistry of the body?
Well, we have a physiologic function in our body where old bone is replaced with new bone, and that's triggered by the forces a root puts on that bone. If you're missing that root, the body doesn't know to do that anymore. With the mini implant, that actually replaces the root, and the body again is then treating you as if a natural tooth is in there.
So when the titanium post goes in, the bone actually, I'm told, grows around it. So it makes it tighter as time goes by.
That's true. That term is osseointegration, John, and that's exactly what happens. So that implant does become tighter.
And those back teeth are important too. We talk about the physical face. If you're getting sunken in, that's what happens when you don't have teeth in the back, and then you look so much older than you really are.
Oh, absolutely. A smile is just the entry into your soul, basically. And if you have a sunken in cheek, you just tend to look older, and you may not look as happy as you are.
And the teeth that chew, we talked a little bit about the nutrients that come out of those foods, but you made a point earlier. If the lower teeth are not there, the top teeth don't have anybody to hang with, basically.
That's true. The neighbor is missing. So if you're missing 2 teeth on the bottom, essentially you're missing the function of 4 teeth, because those upper 2 teeth, again, they have nothing to chew against.
So the nutrients are very important because you want to get all those nutrients. You don't want to resign yourself to soft food anymore just because you have missing teeth. And the single tooth option is next in this model, because say you've gone fishing on the Finger Lakes, or you've had an accident, or you've had a problem with your teeth. If you're missing a tooth in the front, I can't imagine how embarrassing that is, but look at how the mini dental implant will change this.
Sure, John. What we do is we place one mini implant in that missing tooth site, and we have a custom crown made that's then cemented onto that mini implant. I always like to tell my patients that a smile is the gateway to your soul, basically. And we've found statistically that patients that have a nice smile, they tend to present themselves better in the world. They get better jobs, they're higher paying jobs. And when you see someone smiling, they look happy. If they're not smiling, you don't know, do they feel bad? Are they mad about something? So a smile is really essential, and everyone deserves to have a pretty smile.
And everybody deserves to make sure they have teeth when they leave your medical practice, because if somebody's coming in, you won't let them leave with no teeth. Everybody has teeth.
That's true. In this case, if you were missing that front tooth, we would put that implant in, and while your crown is being fabricated, then we would put a temporary on, and you would leave the office with a temporary tooth that looks like a natural tooth.
And then when the permanent comes, this is custom made for the patient, is it not, Dr. Bradford? This is something color and how you even shape it. You even talked a little bit before we went on the air about how you have a difference in how you shape the teeth for men and women even.
That's true, John. We give the patient a choice. They get to pick the shade that they like for their tooth. A female tooth is more rounded, so there's a feminine, softer appearance to it, where a man's tooth has more of an angular look. So we incorporate all those things into the fabrication of these teeth.
And it's a made in America product, we should mention, FDA approved. Dr. Brent Bradford is who we're talking to on Innovations in Health. We're talking about the Mini Dental Implant Center of America that he runs at 5100 West Taft Road, Suite 4N in the North Medical Building. It's an iconic building. Everybody knows it. It's just north of I-81 and 90 in Liverpool. Here's the number to call. It's 315-300-7995. And if you want to go online to find out more, it's an easy website, cnyminidentalimplants.com. So make sure you make that call to make your appointment. Now, Dr. Bradford, it looks like you and I have been going to the same barber.
Oh, we definitely are. We're two handsome-looking young men.
Yeah, we could be brothers. That's
we
it.
could,
yeah,
yes.
You're the much smarter of the two. Now let's talk a little bit about who you are. Where did you grow up?
Well, John, I grew up in Evansville, Indiana, which is in the southern part of the state of Indiana. I went to Indiana University School of Dentistry. After I graduated, my wife and I moved to Syracuse, New York, where we currently live. We've lived here since 1999 when we moved up here. We have two sons that we're very proud of, and I really enjoy being in this area.
It's a great area, Central New York. We just love it, right in the middle of the state. But earlier, before you became a dentist, you had another career as well at Bristol Myers Squibb. You were involved in that company.
That's correct, yes. I spent 15 years working for Bristol Myers Squibb in Evansville, Indiana. I did microscopic studies, so I was always interested in the science area. And then, again, I went to Indiana University. I became interested in dentistry, and I liked the exchange of working with your hands and the medical part. And dentistry seemed like a perfect fit.
And your wife is here. You've been married many years, and enjoying a family life here in Central New York. And what's nice about you coming to Syracuse and practicing in Liverpool, you get to know your patients, and you get to see generations now of people coming back to your practice.
Oh, absolutely, yes. We start with the parents. We have kids that I always say they used to fit in the top half of my chair. Now they extend all the way down to the end of the chair.
Well, and that's super. And Dr. Brent Bradford, by the way, we should mention, a member of the American Academy of General Dentistry, the American Dental Association, the American Academy of Dental Sleep Medicine, the International Academy of Mini Dental Implants, one of the founding members. I know that lapel pin you have on
yes,
is a representative
yes.
of that. So with all of those accreditations, I know you're constantly learning and growing with the technology. Things change all the time. And I know you hop on the 90 and head west over to Buffalo, to Western New York to meet Dr. Todd Shatkin. Tell us about that connection and his connection to the mini dental implant and what you bring back here to Central New York.
Sure, John. I started placing mini dental implants in 2006 when I met Dr. Shatkin. I came to a course that he taught and learned the techniques for placing the mini implants, and we've been placing them ever since. And I come over at least 2 or 3 times a year to visit Dr. Shatkin's lab, to visit his training facility, and to keep up on the most recent technologies.
That's terrific. I know you even worked with his dad, his late father. when
Yes,
things
yes,
first started.
I was very blessed to be able to do that.
And that's why you're a mini dental implant center of America, because that technology, and it's constantly changing, the very best is what you're going to get when you connect with Dr. Brent Bradford. And, you know, let's talk a little bit about the patient. You know, Doc, when somebody comes in and they sit down with you, what do you talk to them about in your free consultation?
Well, we gather the pertinent information. We take the radiographs that we need, the imaging, so we can determine, can we fulfill their request. And I say request because I would like to hear what the patient would like to do. Now, certainly we may not be able to do everything that the patient wants to do, but most of the time we can. So the exchange to me is a friendly exchange. You tell me what you're thinking, and then we make sure that we can make it work.
And that imaging that you have, you know, gives you the opportunity to see just what it is that they need, whether it's a mini or some other concern with
Absolutely.
dentistry.
Absolutely.
You know, we all buy our cars, we pay for them monthly, we have a mortgage on our home, and this is a bit of an investment, but you work with the patient to make the mini dental implant procedure affordable.
We do, John. We have a couple of financing companies that we work with. We work as closely as we can to make this an affordable and achievable for the patient.
Yeah, you want to make sure that that patient walks out of there feeling, I can do this, and
Yes.
because you really are going to have a life-changing experience. And it's a one-stop dental experience at 5100 West Taft Road, and that's what makes the mini dental implant even more exciting, because you're not going from place to place, you're in your dental office, in your chair.
That's true.
And patients that are denture wearers, you know, my mom had dentures, and you know, this was long before the mini dental implant procedure, they just sort of resign themselves to the fact that I've got a denture and this is how I'm going to live the rest of my life. Dr. Bradford, it doesn't matter how old the patient is it?
No. Age is really not a determining factor when we're talking about mini implants. We put mini implants in teenagers. Congenitally missing lateral incisors is one area that this is an ideal treatment, because the implant is small. It fits into that small space, and we're able to restore that. And then again, a denture doesn't have to be something that swims around in your mouth. It should be secure, and you should be comfortable when you're wearing a denture. You should be comfortable eating the things that you want to eat and not limiting it to soft foods for the rest of your life.
And having that smile and having that confidence. And it's important you mentioned, you know, teenagers, because the mini dental implant procedure can happen for really people of any age.
Yes, that is true, John.
Yeah. Let's talk a little bit about some of the people that you have helped. I know that there's a woman that we talked about earlier who had a life-changing experience just with a single tooth.
Yes, she visited our office just recently. She had a damaged tooth that needed to be extracted. That tooth was removed, and a mini implant was placed. She is currently wearing a temporary, so she left our office with a tooth in place, so there was no hole there. And when she left, she was standing in the reception area, and she looked back and she said, "Doc, that was the best dental experience I ever had." And that was so nice to hear that, because usually you think of an implant might not be the best one, but in this case, and it usually is.
Yeah, we've changed a lot of lives, and I know one of those lives is your brother.
Yes, my brother Scott, he came over to visit me from Michigan, and he said, "Brent, listen, I really think you need to remove all my upper teeth. I have some pretty bad teeth." And he was resigned to the fact that he was going to be wearing a denture for the rest of his life. And he's a young man, so he's got a long life, I hope. We took a look, we took the x-rays, and determined several of his natural teeth could be saved. So we saved those teeth. We placed 6 mini implants. He now has a cemented, in place, 4-unit and 2-unit bridge, and he's as happy as he can be. He actually called me the other day and he said, "Listen, I got to thank you for not putting a denture in, because I can still taste my food and I can still feel the hot and the cold."
It's terrific that Scott has had a life-changing experience with the mini dental implant. Let's hear from some other patients who have also experienced a life-changing moment.
If you ever need a mini implant, Dr. Bradford is your man. This was the easiest procedure I've ever been through. There is no discomfort, no pain, no anything. I felt great the moment I got off the chair and got up. And then he put the cap on today. Again, easy procedure, no pain, no discomfort. It was great.
Getting the mini dental implants was a life changer for me. Not a second thought about it. I would do it again. This is something that is so incredible.
I feel a lot more confident. My smile feels better.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
Nothing like hearing from those patients who've had their lives changed with the mini dental implant procedure. And your life can be changed if you connect with Dr. Brent Bradford at the Mini Dental Implant Centers of America. He's practicing at 5100 West Taft Road in Suite 4N in the North Medical Building. We all know that building, and it's just north of I-81 and the 90 in Liverpool. Make this call to 315-300-7995. The number's on the screen. Don't hesitate to call. If you think you might want to find out more about the mini dental implant procedure, it's worth reaching out to Dr. Brent Bradford. It's a free consultation. What do you have to lose? You want to find out more information, you go to cnyminidentalimplants.com. The mini dental implant is 5 times less. It is less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. Doc, I know that some people are saying, what do you mean less discomfort? What does that mean? And it really means what it says. It's less discomfort, and over-the-counter medication is what could be used to help.
That's absolutely right, John. It's less discomfort because the small pilot hole that we place in the tissue is really just that. It's not that invasive to have that done, as opposed to a conventional implant where an incision is made and a suture is used to close that incision.
It was totally painless.
What pain? I had no pain.
I didn't have any pain.
It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
And I know that some people are afraid to go to the dentist. And I have to believe that maybe an experience where there might have been a little pain might have been the reason why. Is that correct?
That's correct, yes. Most patients that do have an expressed fear is because of something in the past that has happened.
But so much has changed, and things are so much
yeah.
easier now, so much better.
Yeah, the anesthesias are better. You know, in my office, I will not start a procedure till I am absolutely sure you are numb and you don't feel anything.
Yeah, and you come out of it same day looking so much better.
Oh, there's no question. Most patients walk out very happy once the procedure is done. And again, it's very painless.
Yeah, and with that, if you're taking care, which you should with your teeth anyway, a water flosser is what is suggested.
Oh, absolutely. The water flosser, it rinses very well underneath any of these appliances, from the denture all the way to the gold standard, the roundhouse.
Yeah, and we make it affordable with Dr. Brent Bradford and his team. You can find out more on the website, as we mentioned. So if you're watching for the full half hour here at the Innovations in Health, you're looking at the program and saying the mini dental implant procedure, it's amazing, and it is. And if you just joined us halfway through, you may have missed something we had at the beginning, and that's the models that show you exactly what it means. So let's take another look again, because this is a model of a conventional implant versus a mini implant with the mandible. Dr. Bradford, shows the difference.
John, as you can see in the mandible, the biggest difference is the hole that is drilled for a conventional implant, which is significantly larger than the small pilot hole that's placed for the mini implant.
And it takes longer to heal, and the hole itself is just so much bigger.
That's true.
Now, if you have a denture out there and you're watching and it's swimming around on the bottom of your gums, take a look at this, everybody. Pay attention to how the lower denture is going to be stabilized.
This model shows the 4 mini implants that are placed in the lower jaw. The denture then is fitted with housings and O-rings, and it snaps right into place on those 4 mini implants. And you have a nice secure fit.
And the goop, that adhesive, is gone.
The goop is gone.
Now, odds are if you have a lower, you have an upper denture, and now the sense of taste is going to come back. Take a look at this.
This is an upper denture where the palate has been removed. And you can see that opens up that space on the palate. So now you can taste those foods again, and you can feel those temperatures. It has 6 mini implants in the jaw, and then we snap that denture right on top of those implants. And again, it is a secure fit.
Now,
it's correct.
if you have a denture, but if you want to up the game here a little bit, we're going to show you what's called the Fixed on 6.
This is what's called the Fix on 6, as John said. This is manufactured from a material called zirconia. It's like porcelain. It's a very hard material. It's actually harder than your natural teeth. We place 6 to 8 mini implants in the jaw, and this is snapped into place again. This is non-removable by the patient. The patient never takes this out. Now, I can retrieve this when we need to, which is at least once a year, just to make sure the implants are clean and the tissue is healthy.
And always good to visit a dentist at least once a year, is it not?
Oh, absolutely
Minis
it
or
is.
not. Now, if God gave us our baby teeth and our adult teeth, Dr. Brent Bradford from the Mini Dental Implant Centers of America is going to show us the gold standard with the roundhouse.
This is a cemented roundhouse bridge. It's also made out of zirconia, and it's a beautiful restoration. The lab does a fantastic job in mimicking your natural teeth. The 10 to 12 implants are placed in the jaw, and this is cemented into place. This is non-removable. We don't take this out. It's a permanent restoration.
Now, you could do a lower or an upper or both.
Yes, we can. We can do both, or again, a lower or an upper.
Yeah.
And we clean this with oral irrigator, as you mentioned earlier.
Yeah. Now, if you have teeth that are in the back of your mouth, we talked about how important they are, or you have a bridge or a partial that might be giving you some problems, the mini dental implant will help you, and it's so basic, so simplistic.
Yes, you don't ever want to overlook those posterior teeth. Even though I may be the only one that sees them, they're still very important. They're important in the ability to function and chew your food properly to get the appropriate nutrients. So we place the appropriate number of implants. In this case, there's 4 mini implants, and a 3-unit bridge is cemented right onto those implants.
Now, if you have a single tooth that's missing in the front, a tooth that got knocked out for some reason or a problem, the mini dental implant will help. And this is custom made, right, for the patient?
It is. The crown is custom made at our laboratory. 1 mini implant is placed where that tooth is missing, and then the custom made crown is cemented on, and you're good to go.
What does it mean to you? You kind of made that career change, midlife, but what does it mean to you to have continued on as a dentist and looking forward into helping people with the minis?
Well, the thing I like about the minis is we're able to help a patient to get their smile back and to function again like they should. And then we mentioned earlier that a lot of patients have a fear of coming into the office. But if we can do these things without hurting them, they're going to lose that fear and they're going to become good patients again. And
you have brought people's lives back to them. And that must be very inspiring to you.
It is. It's always great to see a beautiful smile. And that's what we strive to give back to the patient.
And you do. Dr. Brent Bradford is doing that at the Mini Dental Implant Centers of America at 5100 West Taft Road, Suite 4N, Liverpool, New York, just north of I-81 and the 90. The call is at 315-300-7995 and online at cnyminidentalimplants.com. Dr. Brent Bradford, you are an innovator in health right here in Central New York, and I want to thank you for joining us on the program.
John, thank you so much. I really appreciate being here.
Thank you, and thank you for watching.